As the saying goes, if you don't suspect it, you can't detect it. Being vigilant with health issues and seeking early treatment can often be a life and death decision. But what if the symptoms you are dealing with seem like run-of-the-mill abdominal pain, diarrhea, or flushing? This could be a myriad of illnesses, but cancer?
Neuroendocrine cancers happen in approximately 5 people per 100,000 Americans, and they're uncommon tumors.
They can originate from anywhere in the body, so they can be in the lung, the thymus, the GI tract.
And I started going to the doctor and giving them my concerns about what was going on, but all I ever got was that I was having hot flashes.
Many patients that we see in the clinic were told they had irritable bowel syndrome, diarrhea of unknown etiology. So the diagnosis is very difficult to make.
There were so many weddings we either had to leave or we missed, or graduations, or work, because it was like consuming my life.
I'm Dr. Scott McFarland. Join us as we learn about the various forms of neuroendocrine cancers. Discover how doctors detect the elusive tumors and understand how new treatments are giving patients the hope to manage the disease so they can live life to its fullest. That's coming up on Healthy Body, Healthy Mind.
Major funding for Healthy Body, Healthy Mind is provided by Salix Pharmaceuticals. Salix is committed to being the principal gastrointestinal-focused specialty pharmaceutical company providing solutions for patients and healthcare providers. Valiant Pharmaceuticals. Insight Corporation. Insight is a biopharmaceutical company committed to providing better outcomes to patients through the medicines we develop, the education we provide, and our support of the community. Additional funding provided by Ipsen, Global Genes, allies in rare disease.
Neuroendocrine cancer is also known as neuroendocrine tumors, or NETs for short. It's often a frustrating disease that sends patients from doctor to doctor in search of an accurate diagnosis. Statistics indicate that 90% of patients are incorrectly diagnosed, and it takes an average of 5 years for this cancer to eventually be found. Doctors must sometimes work as detectives to uncover the hidden tumor somewhere in the body, based on vague or nonspecific symptoms, making a timely diagnosis challenging at best.
These are neuroendocrine tumor cells, or cells that exist in the body that becomes malignant or can become cancerous. They can originate from anywhere in the body, so they can be in the lung, the thymus, the GI tract.
Dr. Alexandria Fan, an oncologist at Houston Methodist Hospital, says the tumors can also originate from the pancreas, a disease called pancreatic neuroendocrine tumors.
But the most common neuroendocrine tumor or carcinoid tumor are in the GI tract, meaning the small intestine and the large intestine.
Dr. Edward Wolin, a nationally known expert at treating neuroendocrine tumors at the University of Kentucky Markey Cancer Center, says the majority of these tumors grow very slowly.
If a neuroendocrine cell has a mutation that makes it start growing in an uncontrolled way, we call that result a neuroendocrine tumor, which is also synonymous with a neuroendocrine cancer. And in many cases, these are given a nickname of carcinoid.
Carcinoid tumors have been called cancer in slow motion because often patients with carcinoid tumors may have lived with the disease for many years before a correct diagnosis is made. When carcinoid tumors spread to the liver, however, this once quiet cancer now wreaks havoc on the body as it develops hard-to-ignore symptoms called carcinoid syndrome. Dr. Eric Nakakura, gastrointestinal surgeon at the University of California, San Francisco.
The typical patient with carcinoid syndrome has a tumor that arose from a portion of the small intestine called the ileum. Over many years, the tumor initially spreads to the surrounding lymph nodes and ultimately to the liver.
When you have carcinoid syndrome, the high serotonin level makes the intestine have a lot more activity than normal and results in diarrhea. And this is one of the hallmarks of carcinoid syndrome. Another one of the major hallmarks is flushing. Flushing is caused by dilating of the blood vessels in the body, and the blood vessels in the face and neck are very close to the skin, and the skin in those areas is particularly thin.
Dr. Emily Bergsland, an oncologist at the University of California, San Francisco Medical Center, adds to the list of the symptoms a person with carcinoid syndrome may experience.
The other thing to remember is that patients are also dealing with an underlying tumor. And so they might have side effects from their tumor in general, which could be overall fatigue or some abdominal discomfort. And so living with their disease is living both with their tumor, but also living with the hormone-mediated symptoms.
The diagnosis of carcinoid syndrome is a major challenge, and it's for a number of reasons. One, it's a relatively rare tumor, so very few physicians encounter patients that have it. The other thing is the symptoms of carcinoid syndrome are very germane. For example, flushing of the face and diarrhea are probably the hallmark symptoms of carcinoid syndrome, and it's usually, unfortunately, many years before patients with the disease are diagnosed.
The average patient is seeing doctors approximately 12, 13 times before a diagnosis is ever made. They typically go to more than 5 different specialists before somebody thinks of making the diagnosis.
Frustrating is often the word used to explain the long journey most carcinoid syndrome patients endure on the road to finding a diagnosis. Ray Martz, who makes his home in San Francisco, learned of his diagnosis relatively quickly due to a blockage in his intestine.
I was having some problems with stomach aches and diarrhea, but I just attributed that to poor diet, and I sort of slushed it off for the longest time. And it wasn't until one day that I came home early from work, and I told my wife, I said, I've got to go to the doctor, I think, or just lay down. I just am not feeling well. I've got a very bad stomach ache. And she looked at me and said, no, we're going to the doctor right now.
For patients with carcinoid syndrome, a typical presenting complaint is abdominal pain and possibly symptoms suggestive of bowel obstruction. In fact, Mr. Martz is one patient who had initial abdominal discomfort and ultimately was hospitalized with a partial intestinal blockage. It's from that hospitalization that a CT scan was done that revealed numerous liver masses.
After the scan, the first few doctors Ray consulted told him his cancerous tumors were inoperable, and he would be resigned to a liquid diet and an uncertain fate.
They told me that there's nothing that could be done, that it was in an area of the intestine that couldn't be removed, and that I would have to live with it. It was very life-changing.
Not willing to accept his prognosis, Ray and his wife researched a team of doctors that specialized in this rare cancer.
Because this is such a rare instance, that what was required was working with a team of doctors at a research hospital, and UCSF would be the one to do it.
He underwent 2 surgeries to remove the tumors. As Ray describes it, it was the first surgery that gave him back his life.
The big thing was to get rid of this large tumor that I had in the intestine and try to go on with my life.
Whereas the first surgery removed the blockage from the intestine, the goal of the second surgery was to remove as many tumors as possible from the liver, often a typical procedure when dealing with carcinoid tumors.
The second surgery was actually focused on debulking the liver disease. And again, the idea wasn't so much cure, but the goal of setting the clock back and trying to reduce the tumor burden.
There are many potential triggers for carcinoid syndrome, and each person has different triggers, but some common triggers are stress. That could be emotional or physical.
Certain foods and alcohol also act as triggers.
So triggers that can cause more carcinoid syndrome include anything with amine in it. So barbecue food that is very burn, that has burn amine in it, okay? And of course, alcohol, especially red wine. You hear red wine is protective for your heart, but it can trigger carcinoid flushing as well.
As with all cancers, early diagnosis is crucial, and therefore, doctors who suspect this type of cancer will often use various tests to identify the type of tumor, its location, and determine whether the tumor has spread to the liver. The challenge becomes identifying carcinoid syndrome from vague or non-specific symptoms, such as diarrhea or flushing.
Carcinoid syndrome diagnosis in somebody with a known carcinoid tumor is easy. If you know that somebody has a metastatic carcinoid and one day they come in with diarrhea and flushing, that's carcinoid syndrome. However, the tremendous challenge is in the general population when people are complaining of diarrhea, complaining of flushing, complaining of both things happening at the same time. How to sort out who has carcinoid syndrome causing these symptoms and who has irritable bowel, ulcers, Crohn's disease, psychiatric problems, all kinds of different things.
I started going to the doctor and giving them my concerns about what was going on, but all I ever got was that I was having hot flashes or I was going through my change and different stuff like that, but they never could understand, you know, why would I have the diarrhea? It had to be the food or something that I was eating. So it went on, and I must have went to the doctor maybe 6 months or more before I was diagnosed with what was going on.
Olivia Fobbs, a resident of Houston, refused to accept the diagnosis of the various doctors she visited. She was convinced her illness was more than just symptoms of menopause.
Oh, I knew my body, and I knew something was going on wrong. I kept going. I didn't stop. Every month I was going to 2 or 3 different doctors to find out what was going on.
5 years ago, Olivia became the patient of Dr. Fan. Dr. Fan says that although specific tests are performed to discover the presence of carcinoid tumors, she advises patients to follow Olivia's example and be diligent. Act as your own health advocate.
Your symptoms, think broad. Think beyond the common disease. Then you do those tests, those biomarker tests, the urine test, the blood test, the chromogranin A in the blood, the 24-hour urine 5-HIAA. If those are abnormal, the next test is imaging, either ultrasound, CT scan, look in the liver, looking for the whole body, but most of the time it's in the liver.
If the finding is abnormal, as in Olivia's case, a biopsy is performed.
The biopsy makes the cancer diagnosis. The biomarker that can easily obtain leads or guide you in the direction of where to go. Should you do more testing, or is this something that is not that rare?
Oftentimes, surgery is elected as the first course of action. Remove the tumors. Other times, targeted medical treatment with biological agents, such as a GI hormone therapy, is recommended.
So she is very much in the early phase, but we have many other options for her, including clinical trial, targeted therapy, liver-directed therapy. All of those things are an option for her as the disease progresses.
Well, like she said, we never know what's going to happen in the next year. They always coming up with something, so we never know. So, but it's something that I've accepted, and I'm okay with it.
Neuroendocrine tumors all arise from hormone-producing cells, which produce a variety of different hormones, depending on where they originate in the body. A neuroendocrine tumor that begins in the pancreas can produce several different hormones, yet has many of the common and confusing symptoms of carcinoid tumors, which again often leave patients searching for an accurate diagnosis. Coming up, we will meet a couple who traveled far and wide to find an accurate diagnosis, but it was a local doctor who gave them hope. Pancreatic neuroendocrine tumors originate in islet cells. Apple founder Steve Jobs suffered from this rare form of cancer. If you'd like to see this program again or watch any of our other Healthy Body, Healthy Mind programs, please visit our website at hbhm.tv.
Probably started about 2005, 2006, and when I was having the stomach pain, I went to the doctor, and then, they said they thought it was my gallbladder, so they, did that test, had the gallbladder out, but I was still, having pain. So then they checked for celiac disease, which is the gluten, tolerance thing, and that came back that, that was fine, that wasn't. So then the symptoms kept getting more severe, and so the doctor said that what he thought it was Crohn's disease.
Lynn Vogt, a wife and mother of 3, lives in Albany, Indiana. Lynn remembers having to make major life adjustments, like quitting her job at the local high school, because her mystery illness was too debilitating.
There were so many weddings we either had to leave or we missed, or graduations, or work, because it was like consuming my life. And I kept going to the doctor, and nothing seemed to help.
At the present time, the average time that elapses before a diagnosis is made is more than 5 years. That's extraordinary.
Finally, though, Lynn was diagnosed with pancreatic cancer, a terminal illness that gave her little time.
I was just in total shock and thinking, I don't have time to have cancer. This is not going to work for me. I have 3 children.
Peter, Lynn's husband, vowed to get answers to help his wife get the best possible treatment. The two would lean on each other for emotional support.
I'm a fix-it guy. I fix it for things for the neighbors. I'm the go-to guy. I can't fix cancer. I can't make it go away. And so my job is to really do all that I can do. And if I'm a basket case and I don't take care of me, mentally especially, there's no way I can help Lynn.
In June of 2012, Lynn and her husband headed to the Mayo Clinic for an extensive operation.
We met with the surgeon and had surgery, and got the cancer from my pancreas and my spleen, part of my colon, part of my stomach.
Lynn discovered that her cancer, though it had traveled to her liver, was neuroendocrine cancer of the pancreas, and not the aggressive pancreatic cancer she had feared.
Pancreatic neuroendocrine cancer is definitely not the same as normal pancreas cancer, which we call adenocarcinoma. That's a completely different disease. Her cancer was making the hormone gastrin. Gastrin can cause watery diarrhea, abdominal pain, cramps, ulcers, and lots of gastrointestinal problems when the amount of hormone in the body is excessive.
Like carcinoid syndrome patients Lynn Vogt and Ray Martz, Olivia Fobbs was prescribed the same type of hormone therapy with the aim of shrinking the tumors.
It's made a difference because it's tumors and they have shrunk some, but she's not going to stop searching for other treatments, and that's what she does.
One of the properties of neuroendocrine tumors, whether they start in the intestine, pancreas, lung, or other places in the body, is that they have the ability to interact with a hormone known as somatostatin. And it turns out that this type of hormone can be used to counteract the hormone-producing malignancies by turning them off. It's almost like treating breast cancer with an anti-estrogen or prostate cancer with an anti-androgen. Here we're treating a neuroendocrine cancer with an anti-neuroendocrine hormone.
Last week we went down to UK for our 3-month check and had all of our scans and MRIs and everything done, and we found out that the tumors have shrank over half. It was like 51 and a half or something, but that's still over half. So yeah, we were very, very excited.
Now, you know, we did have the tumor shrinkage, which quieted that clock down a little bit. But I have faith and hope, and I'm staying strong. And you know what? One more day is all we need. I tell Lynn that all the time. Just one more day, and that might be the one that gets the cure. So we hang in there for one more day, and then tomorrow we'll hang in there for one more day.
Just a few years ago, the average survival for people with a pancreatic neuroendocrine tumor was reported to be 3 years. Today, in specialized centers where people treat these types of tumors with modern therapy, most people are living way over 10 years and doing very well for very long periods of time.
In the past, we always said, let's cure cancer. But cancer, once it's metastasized, it's very hard to cure. So the goal for the therapy for this cancer is the same. Prolong life, maintain quality of life, and make it to something that is no longer life-threatening. And I am actually very hopeful.
Doctors advise patients there will be good days and days filled with uncomfortable symptoms. But with the proper diet, specialized treatment, and a strong support system, patients living with neuroendocrine cancers can lead productive and enriched lives.
I think having a good supportive network is important. Having realistic expectations is important. And obviously having a big picture view of this, again, trying to view this as a chronic disease that you can live with.
I'm a huge fan of patient support groups. When people have a rare disease and they've never known anybody in their life who has it, they have no idea what to expect or what to do. To turn to support groups makes all the difference in the world, to interact with other people, to learn about the latest advances in treatment, and giving people hope.
Lynn is getting through each day with the encouragement of her family. She achieved a milestone recently by finally feeling well enough to attend a wedding, her son's.
That was wonderful. The mother-son dance was, we did the twist, and it was just a blast. It was amazing, and I was so happy to be there and feel good. It was a lot of fun. I know this sounds weird, but cancer has been a blessing, has probably been one of the best things that's ever happened to our family, because you learn to appreciate so much more every little thing.
Many people feel relief after being diagnosed with neuroendocrine tumors because of the length of time many endure without an accurate diagnosis. There's also comfort in knowing this disease can be treated and may be converted to a chronic disease that is often manageable as patients enjoy a long life with these slow-growing tumors. That's it for this edition of Healthy Body, Healthy Mind. I'm Dr. Scott McFarland. See you next time. If you'd like to see this program again or watch any of our other Healthy Body, Healthy Mind programs, please visit our website at hbhm.tv. To answer any specific questions you may have, be sure to contact your healthcare provider. To comment on today's program, please call 888-380-6500 or email hbhm@itvIsus.com. or visit our website at hbhm.tv.
Major funding for Healthy Body, Healthy Mind is provided by Salix Pharmaceuticals. Salix is committed to being the principal gastrointestinal-focused specialty pharmaceutical company providing solutions for patients and healthcare providers. Valiant Pharmaceuticals. Insight Corporation. Insight is a biopharmaceutical company committed to providing better outcomes to patients through the medicines we develop, the education we provide, and our support of the community. Additional funding provided by Ipsen, Global Genes, allies in rare disease.